Welcome back to West Texas View.
Dr. Kohler was talking before the break about breastfeeding, the do's. We're going to get to the don'ts in just a minute. But we were talking about getting them ready to start suckling, and that their little stomachs are so tiny, just almost the size of a thimble, so you don't have to get a lot in, and sometimes they have to go hungry for a little while, if I'm summarizing what you said.
Correct.
But continue this conversation and talk a little bit more about the fluids.
Okay, now we've initiated breastfeeding. How do we maintain the breastfeeding is another question for most of the moms, especially if they're working moms. They have to go back to their work at around 4 weeks or 6 weeks after their delivery. So for those moms, I would encourage them to pump and continue nursing. They usually feel that once they start pumping enough, they don't pump, but once they start pumping, they actually don't make enough to meet the needs of the baby, which is not actually true. So you have to continue pumping. Like, the more frequent you pump, as I said again, the more you take, the more you make. So the more frequent you pump, the more you make. Again, if you have a chance, like even the baby is sleeping or after you come back from work, have the baby on you. That stimulus is very, very strong, and that will help the breastfeeding and the nursing process to be a success. So just go ahead. If you don't have time enough during the day, when you come back from work, just have a shower, have the baby onto you, even though the baby is not hungry. At least few suckles will initiate that hormones, and that keeps you going. So that's one thing, the frequent nursing and pumping. And one important thing that all our mothers forget is to eat and drink on time. It's very important that if the moms are starving, or if they have, like, acidity and stomach problems, that will be passed on through the breast milk into the baby, and baby turns out to be more colicky, and the colic baby will mess up your whole day. So it's like a vicious cycle which is following. So please take care of yourself. I know you are important for your family, but again, you have to take care of yourself. So drink lots of fluids, juices, soup, milk, water, anything that you can hydrate yourself. Tons and tons of water is the best thing, and they'll be surprised, even if you drink like a gallon of water, you would hardly go to your bathroom. So that's really helpful.
And now, who tells that mother about all of those things? Do you as the pediatrician, or does the OB/GYN?
It's actually a role of a pediatrician, but again, even the OB will go ahead with it, because it depends on how comfortable, the level of comfort for the mom who she wants to approach regarding this. But again, for every visit, the pediatricians make sure if she's breastfeeding, we encourage more to continue it, and we will help in every possible way to encourage this.
Well, I always wanted to be prepared before I was getting ready to do something.
Right, so the preparation starts from OB and it continues into the pediatrics.
Okay, good, that's what I want. Okay, now let's talk about some of the don'ts.
Okay, so the most important don'ts is do not drink alcohol. Most of the moms who come to my clinic say drinking a cup of a beer, it helps to produce more milk. That's not true, that's a myth. Any consumption of alcohol would be harmful for the baby. So please, when I said liquids, I do not mean alcohol. So please make sure you don't drink that.
But that really goes back to when they're pregnant too.
Right, it starts all the way. So, now see, the baby when it's born is about 9 months already. So the baby has been, the formation has already started, like 3 trimesters, starting from your first trimester. And actually I would say, and I think Dr. Anderson would agree, when you actually want to prepare to have a baby, stop giving up that, because that has a significant effect. And what we call as fetal alcohol syndrome, that depresses the growth of the baby. So even mentally and physically, the baby is not completely grown. So we definitely discourage the use of alcohol, even before, during, and after. So.
And then also the same applies to smoking.
Absolutely, no smoking. My moms come to me and say, oh, I gave up smoking when I was pregnant, but now the baby's born, I don't think I'm going to do much harm to the baby. Not true. Smoking is a big risk factor, not just for sudden infant death syndrome, because most of my patients don't know what SIDS is. Sudden infant death syndrome has been related to this. Nobody has known what's the etiology behind it, but smoking is a significant contribution for that. So if the mom smokes, or mom is alcoholic, she can lead to the death of the baby, and I'm talking death. So that's a very big risk factor. And also things like respiratory infections like influenza, asthma, all these things are all triggered. If they have something, it's multiplied when you smoke. And again, smoking, I would not say if you're not smoking in the house, that's okay. No, even when you're smoking 1 cigarette, you go to Midland, you come back to Odessa to take care of your baby, you still have the smoke on your body, in your mouth, and on your hair. So unless you completely rinse off everything, you're still giving that harmful chemicals to your baby. And if it's a newborn baby, there's significant risk of respiratory infections, and you contributing to the death of the baby, you're contributing to the suffering of your baby. So please don't do that.
And when you think about it, what an unloving kind of thing to do, when you purposely do something to harm your
Right, because
child.
moms come to me and say, I'm stressed up with the baby. But yes, you're making the stress even worse by smoking it, because when you smoke, you give the risk to the baby gets sick, and you keep going to the doctors, to the hospital, and get admitted and go to the ICU. So it's another big risk. So you are creating a stress. So I understand it's a stressful way, but you have to try to get out of it.
So don't start smoking in this.
And don't continue smoking.
Okay, another thing, a lot of people ask about formulas and
Right.
how hard it was to find one that fit.
Right. The current trend actually has a lot of formulas which is trying to mix in DHA and ARA, which is a significant factor for the brain growth and the eye development of the child. But I would say nothing can beat breast milk. Breast milk is the best milk. It is the golden drops, and that helps. We have a protein called lutein, which is only available in the breast milk, which helps in maturation of the brain and the eye. And most of the moms don't know that. They think WIC provides us the formula, so let's just go ahead. But please try breastfeeding before that. And depending on the formulas, if the baby does not have any significant risk factors like galactosemia, which is a problem of digesting the carbohydrates, you can choose any regular formula. And nowadays, I think in the market, there's a formula for spit up, there's a formula for gas, a formula for colic. So, and my sincere suggestion, before you try different formulas, don't shop formulas. First, you give ample amount of time to your baby. So if you're giving your baby a formula of one brand or one kind, give at least a week's time to see if he has any reaction. And by reaction, I mean having any blood in stools, having any significant rash, and increase in eczema. So these three things you have to keep a watch on. And if the baby doesn't do all these things, it's okay. It's just that you feel baby's having extra gas or it's being more colicky. Please don't be a doctor at that time. Don't try to switch formulas, because I've had patients who switch 2 days in one formula, 2 days in one formula, 2 days in one formula, and then baby has severe gas, cannot digest all these things, because remember, baby cannot do all of the things at the same time. Right, it's still in the process of maturation, so your gut is still immature. So be very gentle to the baby's gut.
And that applies to juice and water. If they don't want to take juice and water.
The only indication what I would say water is the baby is severely dehydrated. That's the only indication that we say, and baby is throwing up. So you have to continue breastfeeding, but you can supplement probably an ounce the entire day. But until 6 months of age, American Academy of Pediatrics strictly says no water, because that is going to fill your baby's stomach. The baby's not going to have enough calories, so that way the baby's losing weight.
We're going to have to take a break, and we'll be back in just a minute. Join us then.
Stay tuned. West Texas View will be right back.
Yeah, I don't think we have much to talk about lactose intolerance.
Okay.
But I would say, how long should a mom continue breastfeeding and when to introduce regular milk?